Good morning. Hi, Laura. Hi, Ron.
Hey, how's it going?
I'm good. How are you?
Doing okay.
I see you got your teal on,
Yeah,
all ready for Facial Pain Awareness Month. I love it.
yeah.
How are you feeling today?
Today's okay. Yesterday was really not the greatest, but more so for my occipital neuralgia.
Oh, okay. That's not good to hear. I hope you're feeling a bit better this morning.
Yeah, this morning's actually been quite a bit better. I
Oh,
don't know if
good.
last night I slept wrong or we had a big weather change.
Oh, okay. Can
So,
you tell us where you're at and kind of introduce yourself? And
I'm
yeah,
in St. Louis, Missouri.
cool.
So, we kind of get a little bit of everything. And right now we're um, going more into fall.
Okay. Is it rainy, stormy?
We had rainy and stormy last week, and we're supposed to get more of it this week.
Oh gosh.
But right now it's like perfect.
Good. That's
You know,
awesome.
60s, 70s, and sunny. So,
Perfect. Enjoying those fall days.
oh yeah, those are my favorite.
That's awesome. I saw that you shared on your behind the profile that you love winter even though it kills your conditions.
Yeah,
I love that.
I've always loved winter. I used to camp in it, hike in it.
Wow, that's awesome.
Snow camping's a lot of fun.
Yeah,
I
I
couldn't do it now.
yeah, I have never been snow camping, so I applaud you for that.
Yeah, it was a lot of fun. I'd miss it, to be honest.
I bet. So why don't you tell us a little bit about your background, Ron? I know you have some medical background. I know you're going to school. Why don't you tell us a little bit about yourself?
Um, well, I'm 31. I started working in pharmacy at 16.
Wow.
In the state of Missouri, you can actually get licensed as a tech at 16. So
Wow.
I learned a lot from an early age. Um, I have over 10 years of experience working in a pharmacy, and my health kind of made that um, impossible to do.
Sure.
I also have POTS, and it turned into things that go bump in the pharmacy because I'd be standing too long and pass out
That makes
and
sense.
hit the shelves and knock crap over.
Can
So I had to
you
give
can you tell us what POTS is for those of us who don't know?
Pastoral Orthostatic Tachycardia syndrome. Um, Pretty much it means my brain doesn't know how to regulate when I change positions.
Okay.
So when I'm standing too long, blood pools down from the feet and down into the feet and not in my head, and I'll pass out. If I stand up too quickly, I'll, my blood pressure will drop, my heart rate will go up, and I'll pass out.
Oh man, that's
And
gotta
it
be really
causes
hard.
it causes a lot of other symptoms too. Those are the big ones I deal with, aside from heat intolerance.
Oh, okay.
It explains why I like winter and
Exactly.
cold so much.
Miranda's saying dysautonomia club.
Yeah,
um, I know that isn't it dysautonomia
yep,
awareness month?
yep.
Do you want to touch on that a little bit?
There's multiple forms of it. The other form I deal with is autonomic neuropathy, which that's more of a clusterfuck of disorders. It affects everything. It can cause POTS. It can affect your stomach, your bladder, your motor control, uh, everything like that. Mine
Wow.
mainly affects the small fibers in my motor control in my arms and legs.
Wow. That's got to be really hard to function with that. How do you function?
Some days are better than others. Some days, like writing stuff down, I look like a Parkinson's patient. Other days, I'm fine. My balance is affected, so I stumble around.
Sure. Are you able to work?
No,
Okay. Now
I
you do
am.
go to school.
I do go to school online,
Wow. So what do you go to school for?
social work.
Oh my gosh, that is so cool. What are you hoping to do with your degree?
Work in end of life care in a hospital. So ideally, like in a neonatal ICU or a pediatric ICU.
That's so beautiful, Ron. I love that you want to do that and share that. That's so big of you. That's not something I've heard anyone say before.
A lot of people don't want to deal with death, but I think as a society we need to be more willing to talk about it.
Sure, absolutely. And embrace it and have people like you that are there to help people through that time in their lives.
Even talking to their families about what their wishes are is really important.
Exactly. How did you get interested in that?
Well, when I was starting social work school, I wanted to work like in a disability nonprofit and help advocate for people that are disabled. Um, then I talked to a friend of mine who's a neonatologist, and she introduced me to that and
Wow.
kind of piqued my interest. And the more I did research, I kind of fell in love with that field.
That's crazy. What
And
is a neonatologist?
they treat very sick babies in a neonatal ICU.
Okay. Wow. So that's just even bigger. That's incredible, Ron.
And the thing I like about that is you're dealing more with the parents, not the patient.
Sure.
You're helping walk parents through what could be the hardest decisions that they'll ever have to make.
Absolutely. Wow. What kind of training have you been doing for that, or are you still
I'm still getting
needing?
my social work degree.
That makes sense. So, how do you go to school with everything that you're doing?
Online, and it's considered asynchronous learning. So pretty much I can do school when I feel up to it. If I'm
That's
having a
so nice.
bad day, I can just take care of myself.
That's really nice. And I think that's a big thing for you to share with people because a lot of us feel like we can't go to school and we can't work and we can't do these things. But there are options, for example, for school to make it easier for us to accomplish those things.
Yeah, it took a little bit of searching to find um, a school that had the program I wanted and the asynchronous, but it's been a lifesaver. I'm also registered with disability services at the school, which that saved me a lot. I get double time on tests and quizzes, and then I get an extra 48 hours to turn in assignments.
That's huge. That takes a lot of pressure off of you, I'm sure. That helps it be manageable for you to accomplish your assignments. I
It's
love that you can do that. Was that an easy or a hard process to go through?
At Maryville, it was a really easy process. In some schools, it can be a little harder, but it's definitely worth it no matter what.
That's great that you shared that, and that other people can now know that that's an option for them, and they don't have to just say, hey, I can't go to school because of my TN or my ON or POTS or anything. I can accomplish it because Ron's doing it. Look,
Every school is legally required to have a disability services office and to accommodate.
wow, that's really good information to know.
Mhm.
Touching on that, you also have a paralegal certificate, don't you?
Yeah.
Why don't you tell us about that? That's crazy, Ron. You just have pharmacy technician, you have
I
social work coming in, you have
I
experience around the block.
I got the paralegal certificate just to go with the social work degree. A lot of social work involves the law, so I figured it'd be good to have.
That's amazing that you've accomplished all of that in your 31 years of life. That's really amazing, Ron. I hope you give yourself a pat on the back for all of that.
Eh, it's
Not
it's
enough.
not what I was originally planning, but I think it's going to be good.
How do you deal with it not being your original plan?
Therapy.
Okay.
I worked with a therapist for quite a while to deal with it, and I started out just, doing some soul searching, trying to figure out what I actually wanted. And that's when I landed on this.
That's incredible that you realized that you needed some help, you needed to speak to somebody, and it led you to this beautiful new career.
Therapy is a wonderful thing when you deal with chronic conditions and chronic pain. There's actually therapists that specialize in that.
I would love for you to touch on that more because I know for me personally, I stopped going to therapy because my therapist was not specialized in chronic illness and it didn't feel right.
They're hard to find. Not everyone, like not every area has some. I go through Talkspace,
Okay.
which is great because you can do video, you can do texting, whatever is easiest for you. And she's a chronic pain specialized therapist. She also has chronic pain herself.
Wow.
And not only can we talk about life crap, we
Yeah.
can talk about the chronic pain, and she'll help me figure out ways um, to cope. Um, it's great. And like on bad days, I can text her and,
Wow.
get the help that I need.
That's so nice. And that's through Talkspace.
Mm-hmm.
Is
And
that
insurance
available
covers it.
just is that just available in your area?
No, Talkspace is national. It's an app. Your insurance can cover it.
Wow. Thanks for sharing that. I think that's really going to help a lot of people too. You're just offering so many good advice this morning.
I've had TN and chronic health problems since 2013, so I've kind of learned a lot. Trial,
Yeah,
trial
you
and error.
you figured out how to beat this thing. You're not letting it win. It doesn't sound like
Trying not to.
it. um, I know you do infusion days.
Mhm.
Do you want to talk about that?
I started infusions to try and prevent chronic migraines. I had ran out of any preventatives. Nothing was working, so we took a shot in the dark and tried magnesium infusions because they did help break the migraine cycles for me.
Wow. How often do you do that?
I do infusions. I get medications every other week, but I get saline every week for this autonomia.
Oh, okay.
But what we found is the magnesium infusions and the Depakote infusions actually help tone the TN down.
Wow.
So now we do that, and I also get a steroid to kind of kill the inflammation.
Wow. How
It's
does that
not
affect you?
it's not like a magic bullet, but it does tone the pain down. It dulls it. So
Wow.
it's definitely worth it.
Good. Are there any sort of side effects? Are you just, you know, feeling great when you get out of there? Or do you have a little hangover?
I really don't get side effects too much. The steroids cause tachycardia, but I have a heart arrhythmia, so it just kind of screws with that.
Oh,
Um,
okay.
but other than that, I usually don't feel bad.
That's great. Somebody's asking more about the Depakote infusion. I don't know if I pronounced that correctly.
Yeah, it's one of the anti-seizure meds they can give IV.
Okay. And that
So
helps with the TN or the migraines or both?
both.
Oh, okay.
And Depakote is known as valproic acid.
Oh, perfect. Thanks for asking that, Kenzie. Um, do you want to go over what kind of surgical treatments? I know if anyone's been watching along in Kenzie's video series, I'm sure you've already seen. But do you want to touch on your surgical treatments, what you felt has helped?
Um, I've had an MVD on both sides. Um, my surgical journey is a little different than most people's. I started out having an MVD on the left side in December of 2014, and that um, didn't work at all and ended up making things a lot worse.
Um,
And I was at the point of being completely non-functional. My neurosurgeon did compress the nerve a little bit when he was in there just to see if that would help. And I had about 2 weeks of relief, and then that's when the pain got horrific. So he said that meant that I needed to have the nerve damaged. Um,
wow.
my dumb self decided that I was going to try going back to school less than a month after an MVD. So we decided to do a balloon compression just to try to get me through the semester until he could actually go in and sever the nerve. Balloon compression failed miserably. I ended up with a fourth nerve palsy and had to wear an eye patch. Um, so I still tried to do that semester and killed my GPA.
Oh my gosh.
And May of that year, I actually had the nerve severed, partially
Wow.
severed.
Oh my gosh.
I ended up, the plate caused an infection of my skull and dura. So a week after I had that, I had to go in for emergency surgery.
Oh my gosh.
Um, and then October that year, I had my right side done. He decompressed and severed it.
Wow. Did
Um,
that one help?
yeah, the severing of the nerves have killed the shocks.
Okay. That's great.
I was at the point, I was in the emergency room a couple times a month from the shocks.
Wow. That's,
And now, since 2015, I've only had to go to the emergency room once.
wow, that's amazing.
I still have the TN type 2 pain, but I can handle that at home with heat and pain meds.
That's great to hear. I'm sorry that your recovery and all that process was just so miserable.
A lot of that was due to me. I
Well,
really wasn't the best patient. I'm a little hard headed.
well, it sounds like you're strong-willed and you don't want to let TN win. So I don't think you should blame yourself for that. I think you should be proud of yourself for that.
I will say one thing: if you have brain surgery, don't go Christmas shopping in a mall less than a week after.
Oh no, that's
That was a
horrible.
really bad idea.
Oh no, you are so brave.
No, that was
Um,
stupid.
Miranda was asking that, well, she's confirming that you have AFib, right? And
Yes,
then she wants to know how that is plus the POTS.
sucky. The treatments for the AFib and the POTS is kind of a delicate balance. And like, due to the medicine I have to be on for my AFib, a lot of the medicine for POTS I can't take.
Oh no.
And then the ones that I can, we have to delicately balance the dosage so that it doesn't screw with my AFib.
Oh, great.
So it's just kind of a balancing act.
So you really
Luckily, I have
have
two
the
really good
perfect,
cardiologists.
you have the perfect little pill cocktail going on over there.
Yeah, maybe.
um, I think Lisa was saying that she takes probably the Depakote as pills and it doesn't do much.
I do also take it as pills,
Oh, okay.
and it does help for me at least.
Okay.
But I'm on 3 different anti-seizure meds at the same time.
Okay. And just my normal disclosure that these are just experiences from Ron, and this is what works for him. Everybody's journey is different. Please remember that. And please just take these as experiences. If you want to take anything that Ron says as advice, please consult with your medical team.
Definitely.
Um, Jen is saying she didn't know that severing the nerve was even an option.
It's a procedure of last resort. A lot of surgeons won't sever the nerve. There's a lot of risks to doing it. Anesthesia dolorosa is a major risk, and that I've heard just feels like a bunch of fire ants crawling under your skin.
Ugh,
And really, no medicine or anything helps it. So, a lot of surgeons
horrible.
won't do it.
That
Uh,
makes
the one I had knew what he was doing and had done it before. And it was kind of a either do that or my quality of life's going to be miserable.
yeah, wow.
So we did it. I went into it fully knowing what could happen.
That's crazy. What advice do you have for TN warriors that are suffering right now?
Don't stop looking for treatment options. There's always going to be new stuff coming out. Look on PubMed for um, clinical trials. There's always at least like 70 for TN.
Wow.
It's just one of those different things are coming down the pipeline. always go see a neurosurgeon and see what your options are. I know brain surgery to a lot of people is scary, but it's a lot better than living with TN.
That's great advice. What advice do you have for newly diagnosed warriors?
Make sure to get an MRI, the correct kind, a Fiesta with a cranial nerve protocol. That'll show not only if there's any compressions, but also if you have tumors, MS, an aneurysm, anything compressing the nerve. And even if the radiologist says there's no compressions, take it to a neurosurgeon. They're the best at reading them. And again, find out what your options are. And make sure you go to a doctor that knows what they're doing with TN. Not all neurologists know what they're doing.
How do you know if your neurologist knows? I'm a new TN warrior. I have no idea. How do I figure that out, Ron?
Just ask them.
Okay.
Literally ask them what their experience is with TN, how many patients they've had with it. And you'll figure out real quick if they know what they're doing.
I think you make it sound easy to just stand up for yourself and be an advocate for yourself.
It can be, but depending on your personality type and how comfortable you are with doctors, it can be hard. I think for me, having worked in the medical field, I'm used to dealing with doctors, and
You're not intimidated by them.
no.
Do you have
But
any advice for people who may be intimidated by their doctor?
it's ultimately your health, and they're doing you a service. You are employing them. You have the right to fire them. You have the right to not do any treatment that they recommend. If it's something you don't want to do, you can say no. You can get a
I
second
love that.
opinion. You can get a second opinion. If the doctor gets pissed off that you get a second opinion, obviously they're hiding something.
That's great advice.
Yeah. And if there's constant problems, you can fire your doctor. You can go to a new one.
I think
You're not required to stay with one.
we get so desperate to find somebody who's going to help, and you know how long it takes to get into a neurosurgeon or a neurologist, and then
Yeah.
you finally get there and then it's not what you're looking for. That can be so discouraging.
I'll admit it took me to find a neurologist that would help me. I went through 5.
Wow. So it wasn't so easy.
No. I would stay with one and then figure out that they're just running out of ideas and I'm still in pain, so I'd go get another opinion. And finally, I found one that realized I'm a hard case and was willing to think outside the box.
That's great. And I think that determination of never give up really worked out for you.
I at least have somewhat of my life back.
Yeah. And you're able to go to school and hopefully go Christmas shopping a little bit easier this year.
Yeah, it's called Amazon. It's a whole lot easier.
I love that. What do you like to do for fun?
This year I started getting back into cycling.
Cycling? How do you cycle with TN?
Well, I've got an electric assisted bike, which is great with the pots so I don't overheat.
Wow.
It's helping me recondition myself. And to keep the wind off my face, I have a windshield on the bike. And I also, if I need to, wear one of those like face coverings. The
That is amazing.
It's great stress relief and it's good for the soul.
I love that. How often do you cycle?
I try every day, but depending on how I feel is how often I actually do it.
Yeah. How does it make you feel better? Does it make you feel worse?
Mentally, a lot better. Sometimes physically, I'll come home and my face is worse, but I can deal with that.
Yeah, because I always say that my spirits, when they're high, that helps me function better. Even if the pain's high, if my spirits are
Exactly.
high, I can go.
Very true. I'm the
Um,
same way.
it sounds like your friend Nikki is on here and she's saying your bike is pretty badass. Can we see
It's
it?
um I don't know if I can put a picture of it up on here.
Okay, maybe you can
It's
take a picture later and I can post it on stories.
well, I have one on my Instagram account.
Oh, cool. Okay, I'll find it after and then I'll post it on stories so we can all see it because that sounds
Okay.
really cool.
It's a lot of fun. And even I don't have problems with it even though my balance is crap, which
That's
is
great to know.
it's a, considered a trike. It's got three wheels and unless I do things that are stupid, I can't tip it.
I think that's amazing that you found something that you could modify for TN. Again,
Mhm.
for me, I just do yoga and walk because that's all I can manage right now. Riding a bike is so out of the question for me. That bouncing and, throttling of my head, that would, even just putting a helmet on would probably bother me.
For me, I used to walk a lot, but with the heat intolerance, like even if it's cold out, I'll come back overheated.
Yeah, that totally makes sense.
And like I used to walk every day, but once that hit, I can't do it anymore.
Yeah. I'm so glad that you found cycling and you can do that daily.
Before my health tanked, I actually was a cyclist,
Wow.
but more the like road bike kind. I
That,
could go out and do like an ungodly amount of miles,
oh my gosh.
but I had to give that up, and it took a few years for me to figure out a way I could modify
But you
the
didn't give
sport.
up.
Yeah,
You really have that never give up mentality, don't you?
I guess, yeah, and I think part of that comes from my dad because his thing is there's always a way to modify and make it work.
I love that. I think that's a great philosophy to live by, especially when we're dealing with chronic illnesses.
Hmm. You can always modify something to make it work.
You're giving me hope just saying that and, inspiring me to modify exercise and my life, school, things like that to make it
Hmm.
work for me.
Yeah, you can always figure something out.
What do you do in terms of food with your chronic illnesses?
Depends on how bad the pain is. I do have to eat a high carb diet due to a genetic disorder I have. Um, due to the TN, I do eat more of a softer diet,
What are some of your favorite foods?
like softer.
Yeah.
Um, Things like mashed potatoes, rice, um, Chinese food, cereal, bagels, that
Sounds
kind of
like
stuff.
the typical TN diet.
Yeah, I do also have a thing for sweets, so cake.
Ooh, cake's a good one. That's soft
Yeah,
too.
it's really soft and it tastes really good.
Yum. What's your favorite kind of cake?
Marble.
Ooh, do you make it yourself?
No, I can't cook. I can't cook. I can't bake.
I love that. So, do you
Yeah.
have a bakery nearby that's your favorite to get your marble cake at?
Yes.
I
It's
love that.
actually a grocery store, but their bakery's really good.
Can you ride your bike there?
Yeah, it's pretty close.
That's awesome. What's your favorite movie, Ron?
That's a hard one. I'm not a big movie person.
Oh, okay.
I don't have the attention span. So,
Are TV shows more your thing, or no TV watching, or what do
TV
you like?
shows definitely are.
Ooh, what's your favorite TV show?
Big Bang Theory.
Oh, good one.
I relate pretty well to that one because well, long story short, before my TN got really bad, I was a medical physics student.
That's insane.
So I was medical physics pre med. So I relate to all the science jokes and stuff on that show.
That's crazy. What was your plan with that?
I was either going to go to med school or actually like practice medical physics.
Wow, that's amazing. It sounds like
But
you've always been pretty intellectual and smart.
yeah, um, but now with having all the brain surgery, being on the meds, and I've also had 3 strokes.
Oh my gosh.
The My brain doesn't function at that level, so I had to give that up.
How have the strokes affected you? You're so young.
It's well, having AFib increases your risk of strokes, and that's we think why I had them. Luckily, they weren't major strokes. The only deficits I have from them are some problems with speech,
Okay,
finding words, losing my train of thought, that kind of stuff.
that makes sense.
Hmm.
Catherine is asking, have you found it hard to let go of your goals and dreams?
Yes. Especially not being able to work in medicine. From the time I was 15, 16, everything I did was to go toward that goal of being a head and neck surgeon. And then when I had to give it up because it was no longer safe, really, for me to do any kind of procedure, that was hard. And again, thankfully, therapy's a wonderful thing. And that helped me kind of come to terms with that and helped me set new goals and everything.
And how old were you when you were diagnosed with TN?
23.
Wow, that's really young and a lot to embrace.
Well, I was 23 when the symptoms started. I was 24 when I was officially diagnosed.
Wow. And but you said you suffered from chronic illness before that, right?
The heart.
Okay. So that, I mean, before 23, that's That's horrible that you've had to endure all of this.
My heart problems were diagnosed at 18,
Wow.
but I dealt with them years before that. Just the doctor that I went to was under the impression you're too young to have heart problems. So
Wow.
he never ran any tests for it.
I know a little bit about arrhythmia. My mom suffers from arrhythmia as well.
Mm-hmm.
Have you had open heart surgery?
Never had open heart surgery. I had an ablation
Okay.
where they tried to go in and electrically isolate things so that I wouldn't. Um, but it only partially worked.
Do you want to tell people? I know I kind of just segued into arrhythmia, like everybody knew what I was talking about because I know what I'm talking about. Do you want to tell people a little bit about arrhythmia and what kind of side effects or, excuse me, symptoms you experience?
It's an electrical problem in the heart. Um, with atrial fib, it's actually very common. For me, it feels like my heart's flip-flopping in my chest, and I'll get lightheaded, feel like I'm gonna faint, which with also having POTS, it can be hard to figure out which is which.
Yeah.
Luckily, with the AFib, I get the flip-flopping sensation, and I don't get that with POTS. So that's kind of how I know.
And do you still experience that?
Hmm.
How often do you experience that?
Luckily, with being on the medications and having had a partially successful ablation, it's maybe 1 to 2 times a month.
Wow, that's still a lot though.
Before all that, it was multiple times a day.
Oh my gosh. You have
And
really had a hard life, Ron.
my body definitely doesn't like me. But there's a genetic disorder that runs in my family called Acute Intermittent Porphyria. And they think that's responsible for a lot of what I have going on.
Oh, wow.
And AIP's a really complicated disorder to try to explain. Um, but it can masquerade as just about anything. And yeah, it can destroy your body.
Oh my
And
goodness.
it can also cause attacks, um, where like the attack I had severe abdominal pain, like makes TN look like child's play.
Oh my gosh.
I was in the fetal position, screaming and crying for 2 days straight, and they were giving me doses of Dilaudid that should have killed any kind of pain imaginable, and it wasn't even taking the edge off.
Oh my goodness.
Um, my heart rate was through the roof. It causes tachycardia. It caused my kidneys to shut down. My liver was shutting down, and I was couple hours away from ending up on dialysis.
Oh my goodness.
Yeah, it that attack kind of ravaged my body, and luckily my kidneys and liver started functioning again.
When was this?
2016.
Oh my gosh.
Luckily, I've never had another attack again. I hope I never do. But we think that disorder is responsible for a lot of my neurological problems and responsible for the dysautonomia. and responsible for my heart.
Wow. Is that something you can treat?
It's something where you know you have it. If you're in one of those attacks, yes, you can treat it, but otherwise, you just know you have it and you have to eat a high carb diet to kind of keep it at bay.
Wow. I really hope that you never suffer another attack like that again.
It's definitely not fun. And that's, when they ask what your pain level is, 1 to 10,
Yeah,
that's definitely my 10.
that's just crazy when you say that it made TN look like child's play.
Yeah.
Wow.
Like, I would take a TN attack over that any day.
Wow, that's incredible. You said it runs in your family. Do other family members suffer from those attacks?
Yeah.
Oh my gosh.
Um,
Lisa's asking what kind of attack she came in at the wrong time.
Acute intermittent porphyria.
It's a genetic disorder.
hmm That we think is responsible for my neurological problems, my cardiac problems, um, pretty much everything I have
Wow.
wrong.
How did you find out you had that? Because of other family members?
It's very prevalent in my family, that attack and some lab work
Okay.
and a really good hematologist.
Wow. So it really pays off to be knowledgeable and be an advocate for yourself.
And I know, like, a lot of doctors say don't go on Google, don't research, but that's really the best thing you can do. You need to be knowledgeable, you need to research, you need to know what you're talking about. Going to a doctor and just ranting and raving, wanting, them to do what you want, that doesn't get you anywhere. But if you can sit down and actually have a conversation with them, that will go a long way.
That's great advice. And I think that um, when you talk about research on Google, um, do you have any specifics? We probably should read more than one article, right?
Medscape is a good source. It's peer reviewed, and you can create an account for free. Um, WebMD's not so much a good source. It's written for, like, layman's terms. Um, there's a couple of sources like Healthline that are written by the government. Those are good. Um, a lot of university medical centers will have good sources.
Okay.
Those are always, usually good. Hopkins, I'm trying to think. Mayo Clinic, Cleveland Clinic, those all are usually pretty good. But try to stay away from, like, getting information off of just general internet sites,
Yes. Nikki,
because those usually don't go through peer review and you don't know what you're getting.
that's some great resources that you shared. Thank you. Nikki is saying that she knew all of her illnesses before she got diagnosed because she researched. She knew her body and took notes. Write down what you eat and drink for examples, and if you feel sick after, that is helpful.
Definitely.
Lisa said peer reviewed is the way to go.
A lot of things that help, well, one thing that helps doctors when you're in the process of getting diagnosed is to keep a pain diary
Okay.
and write down your symptoms, your pain level, any triggers, what helped, pretty much anything they're going to want to know to help diagnose. And then when you go to the doctor, bring this so they can look at it.
That's great advice. Thanks for sharing that.
And you can get templates for it online for free. Or you can make your own in a notebook, whatever works best for you.
That's amazing. You have some really good resources. And I know that you offer all these resources on your Instagram page as well.
I do keep some on there. In my link tree, there's a link to my blog.
Okay.
And I have a lot of that stuff on there as well.
I did not know you had a blog, so I'm going to go check that out. I'm really excited to read that.
I don't post on there as much as I would like to. I'm trying to get back into it.
Cool.
But there's a lot of resources on it.
That's really good to know. We just have 10 minutes here. I know it went by so quickly. Is there anything you want to talk about before we wrap it up?
One thing that I know has helped me a lot with pain mentally is having pets.
Yeah.
They're really good for emotional support, and I think that's something that a lot of people don't think about.
I love that. What kind of pets do you have?
I have reptiles, 4 lizards. Well,
Oh,
now 5.
I've seen pictures of them and they're so cute. Can you tell everybody what their names are?
Izzy, Dory, Spyro, and Kian.
Oh my gosh, how cute.
But they all have their own personalities, and if I'm having a bad day, I can get one of them out, and it really helps.
Oh.
I underestimated how great having pets was until several years ago, and I learned real quick they're very helpful.
I think that is such a great point to wrap everything up on. I got my emotional support animal last year, and it helped me so much, especially with feeling alone and, you know, that suicidal ideation, and just knowing that something and someone is there for me all the time, no matter what.
Exactly. And also knowing that something depends on you is a great reason to get out of bed.
Yes. You have 5 little mouths to feed.
Yeah.
What do you, can you take all of them out at the same time? No?
One at a time. They're all
And,
solitary, so one at a time. They're in individual cages.
oh,
So,
and you have pictures of them on your Instagram, I know. So if you want to check them out, make sure to check out Ron's Instagram.
yeah, they have their own Instagram too.
Oh, I love that. I'll have to share that on my stories. You'll have to send me their page.
Okay. Yeah, I'm one of those crazy pet owners that has their own Instagram for the animals.
As you should. That's not crazy. Everybody has a pet Instagram. So what are you going to do with the rest of your day, Ron?
Well, today starts the new term for school, so log into my classes, and my class, I'm only doing one class this term, so figure out what's going on with that and start
That's awesome.
doing that.
What class is it?
Intermediate algebra.
Oh, not my favorite. I do not like math.
I don't like math either, so it'll be fun.
Well, I'm glad you have an optimistic viewpoint on it.
Yeah.
Well, thank you so much for sharing your energy and your time and your amazing advice with us today, Ron.
Thanks for having me on here.
Of course. This will be on the Instagram page and on YouTube after. And
Okay.
I will be sharing your pet page and a picture of your bike and all the exciting things that you shared today.
I'll
I
send this
love your
over.
Instagram for all the resources too.
I'm glad. I'll send over all the stuff we talked about.
That's awesome. Thank you so much again, Ron. I look forward to speaking with you again, and thank you so much for sharing your energy and your amazing advice with us.
Of course.
Have a great day.
You too.
Bye.
Bye.